headline is, in the most recent year, 53% of men who died in the US died under 75. In Australia, 36% of male deaths were under the age of 75.
Welcome back to the Men's Therapy Podcast. Today we are breaking down a massive countrywide data effort alongside the ultimate field leaders in men's health.
We're joined by Peter Fisher and Brian Heilman, the co-lead authors from Movember, the absolute largest men's health charity on the planet. They've just unearthed an incredible, groundbreaking report called The Real Face of Men's Health.
Social norms are an underlying factor that feeds into a lot of outcomes in the report. Men's traditional masculine norms plays a big role in many behaviors that directly affect their health. Masculinity is often presented as a monolith, what it means to be a man, and the reality is much more messy and complicated.
All they hear is you're toxic, you're bad, being a man is bad. You're feeding a narrative that's a little too simplistic and makes it way too easy for people to reject.
Traditional form of masculinity is killing us early. What's going on? Hello and welcome back to the Men's Therapy Podcast. I'm your host, Marc Azoulay, and we're here with two very special guests. We have Peter Fisher and Brian Heilman. They're from Movember, which I'm sure many of you are familiar with. They really do, it's not shaving right during November, but really is for awareness around men's health, prostate health, testicular health, as well as mental health. So they have just completed an incredible report about the state of men's health. And we're going to go through that report together. We're going to talk about some of the findings and, most importantly, what you can do about it, both from a personal level, on whether you're a man yourself or someone that has a relationship with a man, or from a policy level. So I'm really excited for this conversation. Welcome to the show.
Thanks so much, Mark. It's awesome to be here.
Yeah, thanks, Mark.
I just want to start with the story behind the report. So, what was it like to build something of this magnitude? What inspired you all to do it? Like, I'm really interested in, because you're really moving the field forward in a really significant way.
I appreciate you saying that, Mark. And as one of the co-lead authors of the report, both Pete and I were authors of this report, but I was kind of like steering it, I suppose. I'm happy to reflect back on the story. And since the report has been out in the world for a few months now, we have a little bit of a distance and a chance to reflect on it. We had the fortune of being the 6th out of 6 countries where Movember released these reports. So we were able to learn from our colleagues in 5 other countries about what really worked well and what didn't. And I think produced, perhaps the most thorough report in the entire series. And so we're really excited about it. It was a major data collection and organization effort, and we'll try to go light on your listeners, viewers, about the depths of data and numbers here, but we're drawing from a lot of national health statistical sources, the places where you might think the data are, they're nationally collected in a census and in other health surveys. They should be easily accessible, but it surprised me digging into it, actually, how hard it is to find sometimes the sex disaggregated mortality statistics and things. Though they are buried in national health sources, they're not often unearthed. And so we did some of that work of just bringing out the riches of the data sources that are there. So you see a lot of like state by state, what are the leading causes of premature mortality? What are the leading causes of death? How does life expectancy vary? We obviously can't go collect that data just in a new survey ourselves. So we're drawing from those sources. But we did undertake 2 major new surveys ourselves that are also fed into this. The first, we call it the Men's Experiences of Primary Care survey. So we interviewed over 4,000 men across the United States with rich racial and ethnic diversity in that sample, with a lot of questions and all of the participants in the survey had to have seen a doctor within the past year for something. And they're answering questions for us about what that experience was like, any gaps that they might have experienced, and trying to get that, bring men's experience into the whole framework of like gender responsive healthcare, or how can our healthcare providers really show up for us based on the gender norms and gendered realities that we live. And third and finally, we did a survey with informal caregivers for men. So in order to qualify for that survey, you had to be providing direct care to a man in your life. And we're not talking about full-time paid. It has to be a family member, a friend, somebody you're looking after, anywhere from 4 or 5 hours a week up to about 35 hours a week, where you're the one kind of looking after scheduling their appointments, getting them to the hospital, encouraging them to meet the appointments and that kind of thing. And so that allowed us also to tell a story about men's health that wasn't only about an individual man in a clinic or something, right? Like we're seeing the ripple effects. And that's even the title of the report being the real face of men's health, what that's referring to is that real face is not just an individual man in a doctor's office or something. It's the real face is also a spouse who's looking after a husband dealing with prostate cancer, maybe children looking after their aging father who is struggling with some kind of health issue, maybe parents who have a teenage son or a young man who's struggling with some kind of diagnosis or some kind of issue. All of those people we consider to be part of, that the central metaphor of the thing, the real face of men's health. So at least we got the data sources out of the way. Hopefully that's like the more boring part, and we can get into the findings that really stick with us all these years later. But definitely being the sixth of six countries, it also allows us to tell a story about men's health in the US by contrast with those other countries. And I imagine we'll be able to get into some of that here.
I just want to say, before we get too much further to our listeners, we're going to have a link to that report in the show notes. So check that out, and also a link to Movember's webpage so you can check out, their summary of it. You can contribute to their causes. They're a phenomenal organization. So if you want to go into the nitty gritty, you'll have all the resources there to do it. So a question for the two of you, as you were, compiling all this data and, these trends are starting to emerge. I want to start from the personal level for the two of you, actually. Like, did you start to think about your own health, right? Or maybe your father's or your brothers or your grandparents, right? Like, was there anything that was kind of shocking or surprising or like looking in the mirror?
I'd love your thoughts on this, Pete. I have a couple stories, but I'd love to hear from you.
Yeah, it's always so interesting coming from the research world where, we're dealing with, statistics and data. And then once you get so close to it, it does make you reflect a little bit on kind of your own health journeys and things. And for me, what really stood out to me is that there's a section of the report on social connection. We wanted to make sure that we were addressing this because there's been a lot of talk, at the national level in mainstream media about kind of the crisis of connection, the male loneliness epidemic and things. And so we kind of wanted to see what that looked like. And I'm really proud of the, report in that we presented it as, an urgent issue, but also pointed to ways that different community organizations and things that are happening at the state level, people are addressing this. And so it's not that it's a crisis without an answer. And for me, that kind of hit home because, I'm in my mid 30s now, and I felt like I was kind of losing touch with some friends who I, would talk to every day, not just like 5-10 years ago. And so seeing some of the statistics around this, and then seeing some of the work that's being done by a variety of different groups that are highlighted in the report that we can get into, it really kind of like made me reflect and like want to reach out to some friends, because it really is just that easy to, pick up the phone and send that text or make a phone call. And it can really, change the trajectory of somebody's whole week by reaching out. And the bar is so low. And this is work, again, that Movember has done for years around the Movember Conversation Series, the ALEC model, which is a tool on Movember's website for kind of engaging and having these conversations with your friends in your life who are men and other connections. And for me, it was kind of like the data was a wake up call that it was like, oh, this can happen if you're not proactive. And I've kind of felt that in my day to day.
We had just to build on Pete's point, your listeners might be aware that the prior Surgeon General of the U.S. did a big study on social disconnection and social isolation in the U.S. And one of the findings from that work that we lifted up, because it was so powerful even in this report, is there was a survey 20-ish years ago asking men about their close friendships. And I think it was like 15% of guys said that, what was it? Just like the degree to which the number of guys say that they have any close friends at all has just fallen off a cliff in the last 20 years, to where like 1 in 8 men currently would even say that they have a close friend, right? So you see something like that, it certainly makes you reflect on your own friendships, makes you want to pick up the phone. I just took a trip to Wisconsin to see a bunch of my buddies, and I'm glad I did. You know what I mean? Like, you try to then put it into your own life. But if your viewers and listeners pick up the report, they might notice that there's quite a lot in there about, and okay, steering into kind of a dark topic, but there's quite a lot in here about death and men dying. And I was even surprised working through the process of what it means to compile a men's health report, like how much I had to quickly become like an expert of death and morbidity, because like it's just core to telling the story of men's health. Unfortunately, the life expectancy is shorter. The The causes of death are distinct for men as compared to women. A lot of them are preventable. You can connect the dots from these preventable causes of premature death to some prevailing masculine norms and gender things. And it's just like, oh man, you go through and we're looking at life expectancy, causes of death, leading causes of premature death. And so that also hits home in a personal reflection, wanting to be able to be there for your loved ones as long as possible in your life. I had opportunities as we were launching this report, and I'm really grateful for this, like to be able to speak to losses of men in my family. I had an uncle who died suddenly a couple of years back. My grandma, his mom, outlives him, and we had to mourn my Uncle Bruce together. My grandpa on my mom's side, well, he didn't die prematurely. He died at about 80, and certainly had lived a very full life. Like, you certainly wonder what kind of deeper connection could we have had with him if you were around still another number of years? Like, what was lost in the close bond and connection with my grandma? And I kind of honed in on this silly little image, but it's still resonant for me, that I don't know exactly where it comes from. It's kind of like a folky thing. Maybe it's from like Hallmark or something, but like the image of a cardinal, a red cardinal bird, is like a symbol in my family, or maybe in the Midwest, of like the memory of a lost loved one. And so I've watched for years now, my mom and my grandma every year give each other gifts that are a cardinal on a dish towel, or a cardinal on this tapestry or something or other. And I just get emotional thinking about, like, we deserve more time with my grandpa. We deserve more time with my Uncle Bruce, and not these silly cardinals. As nice as it is to, have little ways of remembering your loved ones who have gone. So a broader, truly now, these months later, when I think about what is top of mind, what would I provoke your listeners and viewers to think about, is men dying young. We found in the report that basically the headline finding is that in the most recent year where data are available, 53% of men who died in the US died under 75. So the majority of men's deaths in any year are under the age of 75. 75 is not just an arbitrary number we picked to juice that stat. It's kind of a standard international benchmark for wealthier countries, where if you're not living to that age, we consider it kind of a preventable or avoidable death. You're never going to have 100% of people living to that age, but absent other major health concerns, looking after yourself, you should just about be able to get there. The majority of guys who die in the US haven't gotten there. And here's where the country comparison comes in. Our Australian colleagues, who were the first to release a Real Face of Men's Health report in Australia, they uncovered that 36% of male deaths in Australia were under the age of 75. It's about a third in Australia, where it's more than half in the US. But which itself is a big difference. And what happened almost immediately, Mark, was the Australian government stood up and took notice, partnered immediately with Movember, put deep investment into creating a men's health strategy, are funding deep investments in like better health outreach for men's mental health care. And, the impact was clear and immediate. Whereas I think we've made okay impact, and we've got good readership and download numbers of our report, but certainly there's not a national level crisis conversation happening about men's early death, even though we really outpace these other countries.
There's a lot to dig into, but that last point is actually very interesting to me. Like, what do you think that's about? That like America is in denial, or our government doesn't care in the same way. Like what's going on? Because like you said, our numbers are way worse, and it just feels like a ripple in the pond, right? Rather than the big splash you got in Australia.
I think there's the, responsible researcher answer, which is, look, you're comparing apples to oranges in the United States, the complexity of our population, the inequalities compared to Australia being a much smaller population overall, and a little bit more homogenous. And, you can get into those factors. But I think the more provocative headspace I've been going into, and I feel like I still want to explore more, and I don't quite have it cracked, is there something where we just kind of take it for granted, or like we have come to accept as normal that men live shorter lives? And if so, like, why? Where does that come from? To what degree are we all still kind of too easily embracing, these ideas about kind of a tough macho masculinity, or just like accepting as normal the idea that men would delay seeking help or they would have riskier behaviors. So obviously a lot of what we feel is the groundwork to cover is engaging in that social level, looking at social bad norms about masculinity. And that's at least a space where we as Movember and as a research team and as like a funder of programs, regardless of whatever our national government is doing, can charge ahead. And Pete is here. I'm here to talk to you about also like some of those ways that we're trying to tackle the obviously active conversation about masculinity norms, and to do it hopefully in a way that might feel a little bit novel to your listeners, I guess.
Yeah, so let's talk about some of those norms, right? Because some things that stood out that I want to highlight for our listeners, right, is like, it sounds like these deaths are, like you said, they're early, and of course, if you're doing a health study, like that's the terminal endpoint, right? That's the ultimate data point is when the life ends. But what I heard from you, if I'm hearing correctly, is that many of them are preventable, and also many of them are reinforced by these kind of traditional male norms. So in some ways, this like traditional form of masculinity is killing us early, which is wild to think about.
Well, to be concrete about it, like it would be things like cardiovascular health, heart disease. This is a leading cause of death. So, okay, you're going to run into that at some point, but in terms of like your diet, exercise, like those are kinds of areas where you can take action, and maybe you could see an overlay of some norms there. But the ones that really stand out are like accidental deaths, drug and alcohol abuse, overdose related, risky driving kind of accidents. Like you see something about like risk taking and, dare too, I suppose, kind of like masculinity, or even like the behavioral health conversation around addiction, substance use, and, that as a recourse when mental health is struggling. You can look at places there. And I believe suicide ranked 4th in the United States as a cause of premature mortality. And your listeners would probably be very aware that men die by suicide about 4 times as often as women do in the US. And that's not to say there aren't urgent mental health crises among women and girls. There certainly are. There's even like data about women and girls having more suicidal attempts and self-harm, but men tend to have more lethal means and tend to die more by suicide. So that would be another one where you could connect the dots from a cause of premature death back to social norms that might prevent a guy from seeking help or from seeing alternatives through reaching out to friends, family, professional help, when in that kind of crisis mindset that could lead to a tragic death. So we're trying to, but at the same time, there's an easy, like almost a too easy conclusion from these kind of conversations, Mark, which your listeners would have heard about, which is, so therefore we need to get rid of the masculine norms, like masculinity is toxic, like don't be in the man box, don't embrace these things. And there's a lot of the conversation around it that the phrase we use is deficit based, to kind of like the conversation around adhering to masculine norms is almost always, that's the start of the sentence, and the end of the sentence is you have worse everything if you really adhere to this stuff. And we have a kind of balanced posture with that message, which is like, that is true. There are like the empirical data linking like the most rigid adherence with masculine norms and these negative outcomes is undeniable. And it's even part of Movember's core messaging, like, hey, guys, seek help, get over it, like resist this urge to man up and tough it out through everything. We talk that language. But I think we've also seen in the past 5-7 years, like the downside or the limits to the effectiveness of that being the only message, where, when we really embrace the phrase toxic masculinity as a way of discussing that, then, not every guy is like a gender sociologist. They don't know the deep history of that term. So all they hear is you're toxic, you're bad, being a man is bad. And then you're just almost like, I'm not saying everybody with that view is really engaging in good faith, but in some way you are like feeding a narrative that's just a little too simplistic and makes it way too easy for people to reject it. So I want to give Pete a chance to talk about how how the research literature has created that dynamic and how we're trying to bring aspirational, positive, strength-based messages about masculinity.
Yeah, thanks, Brian. And Marc, it's such a important question because social norms are kind of this underlying factor that feeds into a lot of the outcomes in the report. And so men's navigation of kind of these restrictive, like traditional masculine norms, plays a big role in many behaviors that directly affect their health, like help seeking, having open emotional conversations, feeling connection to close friends who you can, open up about. And what is interesting from like a research perspective is masculinity is often presented as a monolith where there's, the bastion of what it means to be a man. And it's this kind of enshrined idea. And the reality is much more messy and complicated, where everybody has different relationships with the kind of cluster of norms and ideas about what it means to be a man. And everyone's kind of piecing it together from their own experience, their own values, and also kind of societal and cultural factors, as well as kind of family and friends. And so there's no one way to be a guy. And that's an important message I want to put out there. And I think another thing about the conversation around toxic masculinity, or even with research that we've done with the group More in Common, we found that just leading with the term masculinity, because it's become such a charged word, people just associate it with toxic masculinity now, especially in the context of health. And, part of what's really core for Movember's mission is engaging men rather than, lecturing them or so what's really important there is that, and the tone we tried to strike in the report was presenting this information in kind of a non-judgmental way and kind of acknowledging the reality that men, even if they don't agree with or try to follow these tenets of masculinity, it's a constant pressure that men are facing and are socialized in this world of kind of having to navigate that. And so we really wanted to lead with that understanding and show that. But what we've done as another project in parallel with the Real Face report is we've done a landscape analysis, a systematic review of the literature of the research tools that researchers use to measure masculinity and masculine norms. And so we looked going back 50 years and looking at over 60 measures. And what we found is that almost 80% of them tend to take a more deficit-based approach, which Brian mentioned earlier, of kind of problematizing masculinity. So the simple way of operationalizing that is basically those scales, if you score higher on them, that means worse health, right? So more masculinity equals worse health. And that's not to pass judgment on those scales. A lot of them have lent important insights into things like depression and anxiety and establishing these connections. The only reason we understand the link between holding certain beliefs about masculinity and these outcomes is because of that research. But when 80% of the tools available to researchers are using that frame, it really creates an environment where researchers are always kind of be approaching masculinity from this lens of it's a negative and how is it affecting behaviors negatively. And so what we wanted to do is kind of do this review to kind of demonstrate the need for more tools that are taking a nuanced view of masculinity and understanding these complexities and recognizing that masculinity can certainly be a barrier to health, but it can also be a buffer. And when can it be a buffer? And part of the reason that we don't have clear answers to those questions is because there aren't as many tools. And the ones that are out there have only been recently developed in the last 5-15 years. So that's another project that we have currently underway. So yeah, I wanted to kind of mention that as the backdrop. But yeah, social norms, such an important foundational piece to this conversation.
Yeah. Can I ask you about how you and your team at Movember are changing that narrative? I looked up, I was looking at what you were talking like, the 2019 report from the APA, right? The American Psychological Association, that basically said that like masculinity is toxic, right? That's where this thing really, really caught fire. And I think, my industry really screwed the pooch on that one because it pushed so many men away from mental health treatment. It made us the enemy in so many circles. I mean, I remember going to conferences. Hell, I still go to conferences where like men are the demon and the enemy. We're abusers and we're all these like Trumpian type figures, right? Like it's horrible out there. So I'm really curious and hopeful that you and your organization, as well as I'm sure partners, are starting to change the way these things are measured, right? Because like I can tell you guys as researchers, but maybe to our listeners, right? Like if the measurement tools are busted, you're never going to get a clear answer to anything. You're going to get tools and surveys that make people, make guys balk or not even want to engage or not even want to be a part of data collection or let alone being part of solutions. So can you say a little about, how you're starting to change that and make it more maybe strength-based or more positive and less deficit-based?
Yeah. And I think like another layer of it, Mark, is like Pete talked about from a researcher perspective, if this is the predominant paradigm, then even by like building on the groundwork of the field, you're going to keep kind of replicating a certain paradigm.
You're coming in with a bias, right? And like, and what you've been taught by your professors of this whole thing, right? And you have to kind of try to detach yourself from that.
And it's also not that it's necessarily wrong. It's just maybe incomplete. I think like that's the key part of it. And like maybe the point I was going to add is I started to really, because I for 15 years, I am a researcher in the field using tools like that one. I'm not trying to like can every past piece of work I've ever done. I think it like creates, we as guys need to be able to embrace a fair amount of accountability for certain of the ideas that we might perpetuate within our social groups, our families, if they are strongly connected with harmful outcomes. And we also deserve to like have narratives about us that reflect diversity and reflect possibility and aspirations and things. And I think we, like if you're going about this work with masculinity in good faith, you kind of can hold all of that at once and figure out your way forward. But I've also started to fear, and especially based on what we're seeing around like men's misperception of social norms, and we can get into that in a second, is like when you fill out a survey or you're like a part of any research and it's about masculinity, and even by simply looking at the survey questionnaire, the items are men should be tough, men should be dominant, men should be powerful, men should be negative, like restrictive thing, man up, man up. Like in some ways, the survey tool itself is almost playing the role of this negative influencer or something. Like you're telling a guy who maybe never even encountered those ideas before, hey, here it is, here's the legacy. And, you know, like put that in front of a 13-year-old kid and expect him to be able to reflect on it as if he has the wisdom of years and a sociological lens and reflect on whether he agrees with it or not. No, I think we might be doing something a little bit messier and almost like reifying those ideas. So, and if all else is unbalanced, you'd at least want to reify hopeful, positive, aspirational ideas when you're putting them in the questionnaire. So very literally, we are making a scale, like a measure to be used in surveys that we hope will hold together statistically and might be taken up by more broader health data collection or program evaluations or school curricula or whatever, where instead of putting the negative thing that we want guys to disagree with, we're doing the deep theorizing about like, if we don't want guys to just take on the pressure of like, get rich, get ripped, date as many girls as you can, what do we want them to follow instead of that? Like that's the key of this whole point is like, so far 95% of the messaging is just don't be that. And the people that are offering guys something around like, do be this, you know, like the manosphere, whatever names that you could think of, they're providing a clear, do this, go here. Here's a clear path for masculinity. The problem is it's just in its own way too restrictive, or in some cases excessively focused on certain standards or whatever. Leaving that aside, we as I suppose a more like nuanced, hopeful, like for a positive future of men's health movement, need to be able to provide guys like a destination, aspirations, where to go, not just what to avoid. So we are doing the work of having to deeply, it's like I always describe it almost as like this poetry of like, if we don't want guys to imbue the message, get ripped and get rich, get as many girls as you can, what do we want them to do? Like, what is a healthy relationship with money and being a provider? You can't just say, well, no, I don't care if I'm a provider. We live in an economy, guys, and you kind of have to like earn some money and be a provider, you know, and like, so what is a healthy way of like holding your self-worth that includes some amount of earning and providing for your family, but isn't putting you on the brink of mental health crisis breakdown if you lose your job, or if that's, you know, like not the only hook that you can hold your identity on? We're trying to write those items into a survey. In terms of even relationships with women, if it's not about, you know, we don't want it to be about seeing relationships as conquest or, you know, a power over kind of a dynamic, then what does it really look like to have co-equal, cooperative, respectful, you know, and put that in a way where it resonates with guys. Put that into your survey item. And what we hope is that coming out of it is, it's not just like the opposite of the negative scale. It's like a kind of a wholly new thing, 30, 40, 50 sentences that are healthy aspirations that resonate with guys as like, yeah, this speaks to my reality as a guy, not just like universal good human values. Um, and yeah, that also we can show statistically, like flip the thing Pete's talking about. The higher you score, the more of these things that you really seem to embrace, the better your health. Like this is actually what to pursue and what to go for. So, if I know some of this can sound a little research wonky, like who cares about a survey scale or whatever, but like we want it to also be the thing that like a therapist would have in their hand for intake sessions and be able to start a conversation with a guy, not just digging into the worst of restrictive masculine ideas, like more hopeful aspirational stuff. Or so many, and I've been part of them, it's not to say they're bad, but like so many curricula for men in high schools, they're kind of framed around like how to avoid the bad of the man box and whatever, and how to prevent violence, not be violent, again, like what not to be. We'd like to see more co-equal sessions about what to be, and this could be the kind of messages, aspirations, goals that those educators are imparting. And so to the extent Movember is funding programs around the country, I'd probably expect that this tool would find its way into the classrooms or the basketball gyms or the bike shops and cool like spaces where Movember funds youth programs.
I think it's critical. I think like changing the language around how this stuff is talked about is going to seep into hopefully all aspects of society, because I can't tell you the number of men who've come through our doors. I've talked about how they felt like, their ambition was pathologized, their sexuality was pathologized, their, ability to keep it together under fire was pathologized, even their attraction to women or in some ways is pathologized, right? And they're coming as like a walking problem. And it's a relief to encounter a scale or a therapist trained in, the use of that scale or the shift of theory to be like, you're not a problem, man. Like maybe better role models, which I think a lot of men, especially young men, really talk openly about. They're like looking up and they're like, where are those role models, right? Where are those healthy men? That's what we need to be creating rather than just like critiquing from the stands, right? You got to get out into the field and be those types of men that the young guys can look to and want to emulate.
We talk also, and like one thing you said just now resonates where we talk also about how you take one of the classical masculine norms or whatever of like be self-reliant. And I think like if you take a characteristic of self-reliant, you can actually think of a dozen different scenarios where like practicing that to an extreme degree could be harmful and bad for you and bad for people around you. If like you are so resistant to seeking any help that you wind up in mental health crisis, and maybe you are one of somebody lost to a death by suicide because you were so unable to lean on or rely on anybody else. And in that case, you might say, look, an extreme performance of self-reliance has been harmful, and we can code that as masculine. But aren't there equally, if not more, ways in which being self-reliant can also be protective, be good for your health? We think about men in the Movember community who are showing incredible resilience and self-reliance and battling a cancer diagnosis or going through chemotherapy or going through surgeries. And sure, you want to have people, and they very often do have family members, friends supporting them, but you gotta be able to look yourself in the mirror and say like, hey, I'm strong enough, I can get through this. You know what I mean? Like, and so in those circumstances, it would be pretty regressive to tell somebody, no, don't try to be strong, don't try to believe in your self-reliance.
There's something wrong with like taking responsibility for your life. Like you said, there's a spectrum there, right? It's like pushing everyone out and being like the lone wolf, probably not that effective. But like taking responsibility for your life and trying to better yourself and trying to like confront your problems head on, that's masculine, that's brave. I mean, that's courageous, right? I mean, that's what we want to try to instill out there.
And honestly, I feel like sometimes maybe like in our media conversation, we're always like a few years behind, like the worst of the worst. I think quite a lot of the conversations we're having now, at least in the spaces Pete and I are moving in, even within the American Psychological Association, who would have written that paper, I feel like more often the conversations are reflecting some of the nuance that we're having here. I don't think there are dozens and dozens of champions trying to say like, no, deficit-based is the only way, men should feel like a problem only. I think we're trying to find our way to these nuances, and it's interesting. I feel lucky, honestly, to be part of a professional field, a movement that seems to have real like media cut through at the moment that could be really impactful in helping thousands, millions of people see themselves in a more positive aspirational light and still take responsibility for being a good citizen, good friend, good boyfriend, good son, whatever.
One thing I just want to add to this point is kind of circling back to what I mentioned earlier about masculinity being this monolith. And I think it's really easy to fall into this thinking around different masculine norms as kind of like black or white, like you're either self-reliant or you're not. And the reality is that it's contextual, right? Like we're all different things in different contexts, by ourselves, with friends, with a partner, at work. And so, there's times when being self-reliant, for example, can be really adaptive and can help you and can, you need to be autonomous and independent and to be able to function. And then there's other times where it can get in the way. It can be a burden, if you do need help, if you're not able to solve something yourself. In many contexts, that can be a burden, right? And so one thing we're trying to improve with our tool that we're developing, that Brian and I've been talking about, this Healthy Manhood Index, is understanding how context plays a role in this. And because it's so important, right? Like there's no one traditional masculine norm on its own that might kind of be universally bad. A lot of it is dictated by that context. And so having a tool that's responsive to that and understanding that there are certain social contexts where certain norms might be more kind of like salient and more kind of front of mind, and then other situations where it might not be. That's really important. And so we want to be able to develop something that's understanding, and we're able to kind of triangulate that about, men may endorse individually. Of course, I think it's important to be self-reliant, but then at work, they're incredibly differential and right. And so it's understanding kind of the give and take of this and kind of how men are navigating that. And that's as much a tool in the effort to better describe when things are adaptive and when things aren't. When is it a buffer? When is it a barrier to health and other outcomes?
Yeah, well, this is all really great. I'm really inspired by the work that y'all are doing. And we're definitely going to have you back on the show when the tool gets fleshed out, because I'd love to just hear some of the metrics, right, and the questions. But to kind of move back to this report that you wrote, I'm curious, before we move on to solutions, which I know our listeners are excited to hear about, are there any other findings that you want to kind of share, maybe things around, I don't know, different groups? You talked about a very diverse study, right? Or different generations or things like that. Like, I'm curious if there's trends or changes or things. I think that was surprising when you collate all this data together.
Yeah, even looping back, Mark, to the conversation around trying to take this on in the United States versus Australia, UK, Ireland, New Zealand, like some of the Movember countries with much smaller populations, is like we had to reckon with the complexity and breadth of the US population, right? And if I'm honest, I like talking about this point because, I don't know, it just shows how like research can still surprise you. We had pressure to include a lot of maps in our study, like show the state map and show how everything is different state by state. And I was, out of like a principle of justice or something, I was like resistant to showing everything broken down by states, partially because just like you have states with populations of 50 million and states with, okay, not quite. Yeah, states with like massive population, states with smaller population is not a perfect comparator. But also there's kind of a thing in the United States maps where like every map kind of starts to look the same, where like social inequality and racial breakdowns and education level and wealth status and stuff, like you wind up almost like re-stigmatizing the same states over and over again. And I didn't want to be part of a study that was just like, hooray, Minnesota and boo, Mississippi.
It's like I think you're easily politicized too, right? Which I think you all are trying to avoid, right? You're trying to make it about science, not about politics.
And this gets to how we really embrace a health equity perspective as Movember. And what that means is trying to be attentive to where and among whom the need is greatest for any certain health domain. And that's not just a simple blanket statement to say, okay, there are certain populations or identity groups in the US that should always take priority over other population groups or vice versa, whatever. It's that you have to kind of have a subtle understanding. And so to give a couple examples, a core area since Movember was founded is prostate cancer. Black men and men of African descent have a higher risk of prostate cancer in their life than white men and men of other identities. So an equity perspective like demands that we give particular attention to and resources, investment programs to a population where the risk is that much higher. And so we speak to that dynamic in the report. And I think there's amazing organizations in the Black community that we lift up in the report that are trying to get the word out, trying to encourage men to get their PSA tests earlier in life, bringing those tests in a mobile center so it can come right to where you are. You don't have to go to a clinic. Community, faith-based centers or barbershops and places where like you can get the message out in a more common way. But getting back to the MAP thing, when we looked at the deaths by suicide and the rate of suicide as a leading cause of premature death, it kind of flipped this map that I was afraid we were going to see. And you can see a band among like the whitest states of the United States where the death by suicide is the highest. And so and I don't know, like maybe it's important for your listeners, and I hope it doesn't come across, I don't know, too defensive for me or something, but like a health equity perspective requires that we prioritize a white rural community if they are the ones most at risk of death by suicide in this case. So we have this finding where the risk of death by suicide is the highest for every race and ethnicity group and younger ages. It is like there's a peak that happens from 18 to kind of your early 30s, the moving into adolescence and major life stages, or even like early fatherhood, we're finding can be a risk of suicide. But for every race and ethnicity group, it then just drops significantly as you get into your later 30s, 40s, midlife, and onward, except for white men. For white men, there's a bar chart. Whatever, there's a line chart in our report that shows the line for white men then just stays high, whereas every other race and ethnic group, it declines in later ages. So men in their late 30s, 40s, 50s, 60s, the risk of death by suicide is not meaningfully different than the risk of death by suicide for like teen white men. So this is one of a few different findings where, look, the honest accounting of the stats is that though we might presume sometimes that white men as the majority group in the United States are kind of the benchmark or the standard against which to compare health of minority groups, like white men are not the healthiest or the most thriving identity group. So and these are delicate stories to have to tell. And hopefully we've done it with real tact and care in the report. I'd be interested for your readers' take on whether we achieved that. I really need to thank all of the co-authors for helping us walk that line. I mean, like truly the leader of this study was not Pete or myself. It was Professor Derek Griffiths at the University of Pennsylvania, who is an absolute field leader for decades in a health equity perspective for men's health issues. We had a couple people from his team, statisticians from our team, and other policy experts join as co-authors. So we all feel as an author team that we were able to tell complex but compassionate stories from an equity perspective that we're able to hopefully feel like they honestly reflect the realities of different race and ethnic and age groups, in a way that honors everybody's realities, doesn't hold everybody to the exact same standard, centers that every community deserves to have access to high quality and affordable healthcare. Every community in the country deserves to reach much higher life expectancy and break beyond that premature death boundary. And where the gaps are the greatest, we've given more attention.
Yeah, so that dovetails nicely into our solutions segment here. So I'm curious, and I'm actually more curious on the policy side of things, because we've had many guests that talk about the personal side. We have a lot of therapists and social workers and coaches and things like that. But I think y'all have a really unique window into like what could be done from a policy level or from a larger organizational or community level. So I'm curious, in your report has recommendations or what you think it needs to be done on a more societal scale.
Yeah, Pete, I don't know, maybe you want to overview just like how the report itself worked through some of the recommendations, then I can speak to a couple other things we've got going.
Yeah, absolutely. So the report we break out solutions at a couple different levels. So we start, here are some federal policy level recommendations, state level policy recommendations, community organizational level recommendations, as well as individual recommendations, research recommendations, and clinician recommendations. So we really split it out by a couple different domains. And in each of those sections, we highlight plans and strategies and policies and programs that are out there and that are working. And some of these at the federal level, for example, might be in other countries. But at the state level in the US, there's tons of exciting stuff happening. And to Brian's earlier point about, every map of the US kind of looking the same, a lot of these are happening in states where we might not expect that. And so what's cool, for example, is like Florida has a council on the social status of Black men and boys. They put out an annual report. They have a lot of great resources. As researchers, we can tell you when working with policymakers, data is kind of the foundational step to getting things done. Is like you need to bring evidence to the table to drive policy. And so when this is happening in states where they're prioritizing men's health, they're bringing this kind of lens at the state level. It's really what follows is then policy that directly addresses that. And so Utah is another state that has a task force on men and boys, and they're looking at kind of social determinants of health, and that's like part of their legislative approach. Tennessee puts out an annual men's health report card that is used to help allocate resources accordingly. And so lots of great things happening at the state level. And again, Movember has many deep partnerships with a ton of great community organizations, ones we fund, ones we work with closely. And going back to the earlier point about, engaging men being a really core principle of Movember, part of that is you need to meet men where they are, both like in terms of their awareness and health literacy journey, but also physically and emotionally where they are. And some of the organizations that are doing this approach are awesome, with Native Americans working in Native circles, Black Americans going to Black barbershops, faith communities, and doing things like prevention and screenings, bringing those things that otherwise people would have to go to a healthcare center, bringing those to the places where men already are. And some of these community organizations that are doing that have had great success because there's trust there, right? There's already a level of kind of understanding and communication that's really important for bringing men into along on this kind of health journey. Other kind of models, peer support models, like men's groups across the life stage. We have a couple of great different examples. U.S. Men's Sheds is an example. International organization, really cool, focused on kind of building social connection among older men. A men's shed can be just a garage where you hang out and do woodworking together. But for guys who are, 65 plus, that's like an important part of the social fabric and can give them purpose. And there's other groups as well. We're partnering with Laureus Sport for Good and a couple of different organizations, including Beyond the Ball, about kind of peer-based mentorship where, it's like high school age young men training and mentoring boys in kind of a sports context. And then we're adding in this kind of like mental health layer. And so these are programs that Movember has developed and distributed to these groups that are now trying this model at scale with different populations to great success. And so those are some examples there. But yeah, I think, again, there's been exciting developments at the federal level in other countries like Australia and UK, Ireland, all have national men's health strategies. I think in the US, it's just kind of a different political landscape at the moment, but we are seeing a lot of momentum at the state level. One recent exciting thing in California is that we're bringing Movember's kind of flagship clinical training program called Men in Mind, which has been in place in Australia for a few years now. We're piloting that in California. And I think for your audience and for you, Marc, this might be exciting because this is an upskilling program about how to engage men in therapy and kind of understand the gender responsive lens there. So, are you perceiving frustration or distancing or avoidance? What does that mean? How do you interpret that in a clinical setting and work with men to kind of achieve better clinical outcomes? And so this is an evidence-backed RCT tested trial program that's been proven in Australia. Now we're piloting that and scaling that up in California. So these are some of the solutions that we highlight in the report. Men in Mind, I think, actually just happened after the report. So sharing that with you now. But there's a lot of momentum at multiple levels, ranging from the state to the community level, as well as research, right? Research needs to follow. We've already kind of spent some time discussing it, but kind of taking a different tact in terms of approaching with strengths, leading from understanding what men are aspiring to and addressing that, being able to measure that and creating research paradigms that are engaging men in that respect as well.
Yeah, I'm curious about, I don't know if you have, it's probably a simple question with a complicated answer, but how many of these community organizations are growing and how big they are? Because I think a lot of people in our field talk about the death of like the fraternal organizations, right? The ALEC lodges, the Masons, fraternities, and they had their own issues for sure, right? They were not perfect solutions. But it sounds like some of these more nonprofits, or more like you said, the Men's Shed as an example, are taking their place. Is that happening? I'm just really curious from a database perspective. Like, is that happening, or what? How's that shift starting to occur? Or are a lot of men still without connection to larger communities of men, or healthy communities of men? Maybe is a better way of saying it.
Yeah, I think what we're seeing is like there have been shifts. Like obviously during COVID, a lot of social connection moved online for a lot of people, and that was one of the factors that kind of has accelerated the decline of some of these older institutions, brick and mortar institutions. And we're still seeing like a lot of, especially young men, finding community online. And that space is not going anywhere. But that being said, I do think there is now kind of like the pendulum shifting back a little bit of like the desire for shared space and community and connection in those spaces. And I think, men's sheds in the US, it's relatively new. In other countries like Ireland, the UK, Australia, it's more well established. In the US, it is rapidly growing. And part of their model is actually, it's designed around older men kind of in the later years, but there's also a mentorship model where they can bring in younger men to like learn skills that these older men have and that they can train them on. And that works both ways, right? Where it's creating connection across, the life course and providing older men a sense of purpose and being able to kind of give back to younger men and mentor them. And so that's really exciting. And that I can say U.S. Men's Shed's definitely growing. They're involved at the policy level in the U.S., a lot of the Congressional Men's Health Caucus and things like that. And yeah, in terms of the groups that we're working with, we've recently expanded the number of groups as part of that program. It's called Movember Game Changers, that sport kind of based mental health training, peer-to-peer training. And so that's scaling up for us. And there's a ton of demand. I don't remember the number of people that applied to be a part of that program, but it was way more than we could actually fund. And so there's definitely interest in groups that are addressing this. And I think partly it's this response and understanding the shift kind of from the COVID era now to like back into the more physical world. But also, understanding that these issues of connection are real and that there are many groups out there that are focused on it. And there's certainly a lot of demand from the men in the Movember network.
I think your question, Mark, is very fair. And it's kind of like one of these old rhetorical questions where like, I think if there were a mass re-energizing of like men's fraternal organizations, we and your listeners would probably know it and have seen it and be part of it. And very clearly it's not happening and hasn't been for a long time. But Pete's touching on some of the ways in which Movember are, trying to make real impact at smaller level, community level. Maybe it reaches a few hundred guys in that particular community. It's not quite yet catalyzed a national movement, but look, it also offers up an opportunity for anybody in your listenership who isn't really familiar with the Movember campaign idea itself, but your question is not far away from like the organizational like premise of why we think Movember works. So, I mean, you're talking to a couple, fancy researchers of masculinity who are affiliated with Movember, but like we're at a pretty highly evolved moment of what this movement and what this organization is. The founding of Movember and still like kind of the core of the company is a bunch of jokester friends in Melbourne, Australia, who challenged each other to grow a mustache, thinking they would all look kind of stupid wearing mustaches for the month of November, just as a way to fire up conversations around men's health issues. And at first it was like merely a kind of a social prank. At the end of the month, they would cut a check to the Prostate Cancer Foundation in Australia for whatever they were able to raise. But sometimes these, ice bucket challenge or whatever, like these silly little viral things catch on, and growing a mustache for this 1 month and kind of challenging and ribbing your friends about whether their mustaches look very good or not. Nobody would design it in like a theory of change workshop or program design workshop, but it's just like silly and magic enough where it has clearly worked. 25 years later, we're the largest charity in the world that's focused on men's health. Because of mustache donations primarily, we've been able to invest over $1 billion US in the like truly the foundational registries of blood test results for prostate cancer patients that like provides the database from which all prostate cancer research is drawing, and other innovative research that is extending lives with prostate cancer and really truly affecting that. fundamentally getting the word out and changing awareness of testicular cancer, which is a very survivable cancer among young men. And, we hope that we've really made a shift there. And more recently in Movember's history, also like being able to expand our focus beyond just cancers of the male body to mental health concerns, to suicide related work, even to the point now at a more recent degree where we've been able to fund and found a research institute of men's health experts within our organization itself to, as we're discussing today, push the boundaries and push into new terrain that we wouldn't have just been able to fund elsewhere, to innovate the way that clinicians are trained to deal with men, to innovate the way in which masculinity is measured as a root cause of health outcomes, to do all the other, to investigate how men are using AI and to what extent as like AI therapists or AI girlfriends, or we have a research portfolio looking into that, to look at the influence of fatherhood on men's mental health, to you name it, like really push the frontiers, and to echo one of our like core mission areas, just like lift the profile of men's health, lift and expand what it means to investigate and advance men's health. Now, truly, like that, when Movember, the mustache idea works, it works because it's a bunch of guys coming together around something. Maybe they just meet online, but most of our like core Movember fundraisers and ambassadors throw local events in their community. They partner with a local brewery and have guys come together, and they catch up, and they speak personal testimony about why these health issues matter for them. And I think that Movember in the US is doing amazing, but there is incredible potential to grow. And so if any of your listeners are feeling like, hey, I think it might be kind of fun to challenge my friends to grow silly mustaches just for a month, and kind of believe in at least some of what these two guys have been saying as like maybe an area where it'd be good to dedicate a little bit of charitable donation. That's the idea. And like the social connection of it is kind of at the core. I hope that makes sense.
Oh, for sure. Yeah, I think Movember's done incredible work, and I think it's become a household name. Like I think most guys at this point know. Yeah, I mean, they might not know the organization, which I think shows like this are helping, but I think they know that like in November you grow a mustache, right? There's like something that has like hit the culture, right? Of like celebrating Movember as almost like a men's, month or men's health month, which I think has really taken fire, and that's something to really be proud of. I'm curious, as we're wrapping up here, I think we could go for another hour, but we do have to start to end. If somebody is really inspired by this conversation, was an action that they can take right away, whether it be if they're a man themselves or there's someone that's supporting a man, or, getting involved with Movember. I know you've mentioned donations, which will have a link to that in the show notes, as well as reading the report, of course, which will also be linked in the show notes. But I'm curious on maybe a more personal level, what could a listener do to start to put some of these things into action and take it out of just the realm of insight, but into the real world?
Pete, do you want to go first?
Sure. I'll go back to the ALEC method. I mean, it's my favorite thing because it is so easy, but it's so impactful. And again, the ALEC method is just a 4-step approach for having conversations with guys, and stands for ask, listen, encourage action, and check in. Movember has a website about it. But yeah, I mean, asking the question about like, how have you been? That can open the door to all sorts of things. And so I think, if we are more proactive in having those conversations, everybody's health will improve, including our own. And so that's what I would put out there into the world.
I'm going to cheat and have a couple, Mark. I think like a provocative one, since we spent so much time today talking about the masculinity scales and measurement and whether we define it in a negative or a positive way. I think it's a healthy exercise for any man out there, or anyone of any gender identity who maybe is raising young men or has men in their life. Like, try to articulate for yourself, what are your values, not just as a person, but as a man? Like, do you have aspirations for yourself that are rooted in what it means to be a good man? Where do they come from? Do they come from certain male role models in your life? Do they come from media? Kind of interrogate also, like, whatever you feel that you're taking from media depictions or from your broader social environment, how do you relate to that? Like, do you agree with what you've seen in media, movies, whatever, or do you have your own kind of personal stances that might be a little bit different? And we didn't get a chance to go into it, but we also have a whole stream of work where we're trying to look into a lot of the ways in which men's own internal personal values, they can be in conflict with what men perceive to be like the popular narrative about masculinity or how men should be. And we think there's a real power there. It's another solution to help kind of shine a light or hold a mirror up to the way guys are actually feeling and show that, like, our report does it. 95% of men think that it's a sign of strength, not weakness, to seek healthcare when you need it. So nobody out there should be thinking, oh man, I'm, like the male norms in my community is going to shame me if I try to go seek help. Like, but too many guys carry those fears that, the predominant norms are. So get right with your own personal values. And then very practical one, hopefully everybody in your network is already aware of, but there are resources available to you right this second. If you are in anywhere near a state of crisis or need somebody to talk to, we're so lucky in the United States right now that we have the crisis line of 988. You can call 988 anywhere, and within seconds, you're going to talk to a well-trained human being who is a crisis counselor who can work with you. And they'll probably model something just like what Pete said, like an ALEC method. They're not going to tell you what to do. They're not going to try to boss you around. They're going to listen and provide very humane care to you in a tough moment. 988, remember that number. If talking on the phone is a little bit more challenging for you, you'd like somebody to text, we're about to start a new partnership with the crisis text line, which is 74141. You can text at any time, 74141, and have a text conversation with a trained mental health, a human, not a bot or an AI, like a human trained mental health counselor. And there's research that was published just today in New York Times that in the years since 988 has had a major investment and has become more mainstream in the US, demonstrably, and in ways that are linked to the states that have pushed it the strongest, youth deaths by suicide have decreased. Like, it is working, 988. So just really believe in those services. And guys, look, like, this is another space where these are amazing services. Guys die by suicide 4 times as much as women, but we are almost like 1/4 as likely to dial 988 or text 74141. So, I don't always like to lean on the get over it, guys, go to the doctor message, because we could say a lot about the quality of care you receive from a normal primary care doctor and how expensive it is in the US and everything. In this case, I back these completely. Like, if you need it, dial 988, text 74141. We completely back the quality of service you're going to receive there. So thanks.
Great. Yeah, those are phenomenal resources. And yeah, they're free. They're available 24/7. Just like put it in your phone. You never know if you're going to need that or if you encounter somebody that might need that. So that's a really quick, easy action that you can do as we're winding down the show here. Well, Peter and Brian, thank you so much for joining us. As we're wrapping up, where can they find more about you, more about your organization online if they want to dig a little bit deeper?
Well, Mark, sounds like you're going to link to some of the reports and things we mentioned directly, but Movember.com to learn all about the campaign, how you can grow a mustache. And it's not only people who can grow a mustache who are very active Movember participants. A lot of our key ambassadors, fundraisers, and champions are women who very often, unfortunately, have lost a family member to cancer or to suicide, but there are ways to commit to do a certain amount of running, walking, action, or hosting events, hosting concerts and stuff. Like, people find a lot of different ways beyond the mustache to participate, but Movember.com.
Great. And yeah, that will of course all be linked in the show notes. So thank you two again for joining us on the show.
Thank you.
Thank you, Mark.
And listeners, thank you for tuning in. As you know, Men's Therapy Podcast is part of Men's Therapy Online. So all of our stuff is at menstherapy.online. So check us out. If you're someone that is struggling, or you know someone that's struggling and you want to get access to therapeutic services for the guys in your life, if you check us out, we have tons of podcasts, way too many blogs, and we have a lot of free things like online courses. And the big thing that we're promoting this year is we have a Slack channel. It's an online community. We're up to about 300 guys right now that are actively participating and talking about the stuff that really matters, encouraging each other to be more honest, more open, and live better lives. So that's totally free to join. There's no charge, there's no commitment. Check that out online, and that's all at menstherapy.online. So thank you so much for tuning in, and we'll see you next week, another episode of the Men's Therapy Podcast.